Welcome to the Nutritious and Delicious podcast with me, Bethany. My mission is to support busy parents all over the world to learn time management while taking care of your nutritional, physical, and mental health. After all, a healthy family starts with a healthy parent. So I'm super excited today to introduce, I have Dr. Anita Racic here today with me, and she is a functional medicine doctor, and she is specializing in chronic illnesses, and she deals with very complex patients. So she's been in practice for 30 years, and she's very passionate about helping getting her patients to understand the root causes and how to correct them. So these patients actually become an active part of a participant for themselves, creating long-term and sustainable health for themselves. So welcome. I'm so excited to have you here today.
Thank you, Bethany. Thank you for inviting me.
Yeah. So I just wanted to ask you, why did you actually want to become a functional medicine doctor? And maybe you can explain to our viewers here what actually functional medicine is.
Okay. Yeah. Thank you for that question. Functional medicine is looking at, in contrast to conventional medicine, that focuses on the what, right? Like, what is this condition? What is the label that we put on it? Which we call in medicine a diagnosis. So, so in conventional medicine, it is all about the what, and then how do we medicate that what, which is the diagnosis. So, what is the toolbox that we use, and that would be generally pills. So, pharmaceuticals, medications, or perhaps a procedure. So that is kind of like the mainstream paradigm. In functional medicine, yes, we do pay attention to the what, so the condition that has arisen, but more importantly, we ask the question, why?
I love that.
Yeah, why did this arise? What are the causes? What are the root causes? And when we identify those, then how can we reverse that? How can we reverse engineer the chronic disease that has emerged? Furthermore, the toolbox is expanded, right? So, we don't throw out the baby with the bathwater. Sometimes we need to use the tools of conventional medicine, pharmaceuticals, surgeries when appropriate. But there's just so much more in functional medicine toolbox. We're using, lifestyle, right? We're using diet, sleep, exercise, movement, stress reduction. That's the the base of the functional medicine toolbox. But we're also using nutrition, nutraceuticals, hormones, and modalities. Right.
So that's a lot. That's really good though, because what it sounds like to me for functional medicine is that it's a holistic approach versus it's getting people sort of at the end of a state where they're already in disease and they're needing sort of that fix right away. I love how it approaches it as a why, like, why are we getting this in the first place? Why are we getting these chronic illnesses going on? And looking at it from how do we kind of reverse this in a different way. And there's so many things that you can do, I guess. Like, I didn't realize, like, there's hormone, everything that you can do.
Yeah. And you asked, so in terms of why did I get into this kind of medicine? Well, honestly, I got into this medicine a few years back now, when I discovered that it existed, and it was very intriguing. And I had my own health issues as well. So I kind of went down this path of getting educated in this kind of medicine. And I used this approach and this toolbox to address my own health issues. And that really made a difference. And I wanted to bring this to patients as well. And so that's how that came about, that I kind of made a career shift a few years back.
That's wonderful. I love that. So we're actually going to ask you today, we're going to pick your brain a little bit because you do have quite a bit of help here that you can give to these moms here. And today we're going to talk on the podcast about 4 ways to actually support our immunity right now with everything going on in the world. And I'm really curious to see your professional suggestions as to what we can do for ourselves to keep ourselves healthy as just individuals and also our families as well.
Okay, well, one thing, I'm a huge fan of vitamin D.
Love it.
Yeah, yeah. So, as you said, with what's going on in the world, one of the biggest risk factors for coming down with immune-related, disease is vitamin D deficiency.
Yeah.
Right? Yeah. So, and we live in Canada, so that can be a challenge to be replete in vitamin D status. Now, we're out of our summer months right now, but if we had good vitamin D exposure during the summer months, that could theoretically carry us through for about 6 weeks. Or if you go on holiday, if you're getting lots of sun exposure, you could have decent vitamin D levels for about 6 weeks after that, right? And that's provided that, in the summer, you were actually getting outdoors. So it's not just enough to say, oh, it's summer, I don't need to worry about my vitamin D level.
Definitely.
Right? Yeah. So you really need to be outdoors during the right time of day. You need to have exposed skin. You can't be, blocking it with excessive sunblock and that sort of thing, right? So, and I'm also a proponent of checking levels, right? A couple things to keep in mind in terms of our ability to make vitamin D naturally. The more fair one's skin is, the more able the person is to synthesize vitamin D. And so the darker the skin, the more pigment that process gets blocked, because it is the action of ultraviolet light on cholesterol actually in the skin, right? And as we get older, that biochemical process doesn't work as well.
Yes, and I also usually tell people that you need the vitamin D in order to absorb the calcium in your system too. So
they work synergistically. For many. Of course, we're focusing on immune health today, but vitamin D is also important for. It's actually to call it a vitamin is actually a misnomer. It's actually a hormone. Right?
Interesting.
So it acts like a hormone in the body. But it acts on every kind of pretty much tissue. So for bone health, people may be aware of that, but certainly heart health, it plays a big role in that. Immune health, we mentioned, brain health, mood, you name the organ, and vitamin D plays a role.
Yeah, definitely. I think with everything going on in the world right now, I think vitamin D for mood is a big one. And I think there's a lot of people that are sort of looking for alternative routes. But I think at the core of it, vitamin D would greatly help a lot of people boost their mood throughout this time. So I guess with the sunblock on, it actually blocks the vitamin D out. What can adults sort of do for their children if, obviously, I have 2 boys, so I'm lathering them up in sunscreen in the summer, and they're probably as pale as I am right now. So they probably don't get a lot of actual sun exposure in a sense of getting tanned. What can sort of parents do for children that can't sort of take the vitamin D, I guess, tablets, because you have to sort of just swallow them, right?
Well, I guess I would ask you, why are you always using sunscreen, and do you really need that? So I'm not saying that people should go out and get sunburned, but I think that getting safe sun exposure is actually a healthy thing.
Yeah. I do personally do a bit of balance with my boys. I know if we're at the lake or something and it's a really, really hot day, I'm going to lather them in sunscreen. But there's other times where they're just casually playing outside. And I'm it shouldn't be too bad if we're kind of in the morning or the evening. Obviously, the peak times of the day when the sun is really hot, kind of around noon, 1 o'clock or so, most people are usually lathering up their children with with the sunscreen. I personally use vitamin D drops for my boys, and obviously didn't realize I was not giving them enough. So I don't think also people understand with vitamin D, because it is a fast soluble vitamin. It does take time for your body to accumulate that. So can you kind of talk a little bit on that for people that don't really understand that?
Yeah, so I mean, what I would say about that is one thing that we also are experiencing kind of collectively as as people is that there is kind of an epidemic of overweight and obesity as well, right? And so then that is also a risk factor for illness, that is immune related, right?
Right.
And part of that is that vitamin D being fat soluble, it gets sequestered in fat tissue.
What does that mean? Sorry.
I mean, it gets stored. Stored in fat tissue, and it's not freely available circulating in the blood to work on other organs. Right?
Interesting. Okay.
Yeah. So, somebody that, and I forgot to mention that earlier. So, somebody who has excess adiposity or fat would probably need to have even more.
Wow.
Yeah.
That's interesting. It's good to know that, because vitamin D obviously gets stored in the body, and like you said, even if you've been exposed to sun and that wears off, it can last, what you said, up to sort of 6 weeks.
Exactly. So that's because it's stored in fat tissue and it can get released over time.
That's interesting. So I guess kind of going into the winter months and we're seeing less sun, I guess because maybe we're going outside less, people would sort of have to keep those levels up in regards to going into winter still.
Yeah. I mean, yes, we're outdoors more, but it's also has to do with like the amount of sun, the angle of the sun relative to the earth. So all of that has shifted. So even if you were outside as much as you were during the summer months, it still would not be the same. And I do, as I said, I'm a proponent of measuring and supplementing.
That's wonderful.
As required, and that would be, personalized to the patient.
How would you sort of measure that? Like, what do you do with your patients? How do you measure the vitamin D levels?
It's a blood test.
A blood test,
Yeah,
okay.
Yeah, so we can measure it through the blood. Yeah.
That's excellent.
Yeah.
Okay. What's number 2 for our lifestyle changes here and supporting our healthy immunity for this?
Oh, I would say sleep. I and I'm not even sure that we can kind of put them in like ranks, but I think that sleep is so crucial. And so amount and quality.
I think, quality would be, I think there's a lot of people that say they sleep sort of the 7-8 hours, but, they're actually not having the sufficient sleep, especially people who I notice who are obese, maybe, snoring and not breathing at nighttime and kind of waking up too many times. I would say that they probably have a less quality of sleep.
Yeah. So it sounds like what you're describing, obstructive sleep apnea.
Yeah.
That's a very common condition. But yeah, I mean, sleep or inadequate sleep, I would say less than 7 hours of total sleep is associated with an increase in pretty much every kind of morbidity and mortality that you can imagine.
Right.
So, yeah. But I do recommend 7.5 total sleep hours, or more. I'm also a big fan of tracking sleep and getting sleep metrics and measuring sleep, because getting sleep data, I think, can really inform people and give people an insight as to, okay, so I'm not sleeping as well as I thought, and I'm not getting, that amount of total sleep. But, on top of that, it's also important to get a certain amount of deep sleep, REM sleep, but deep sleep is where recovery happens, where healing and repair happens.
What would you say to probably a new mom? Because I know I experienced this with my first son. I had a very colicky crying baby that did not sleep more than probably 2-hour stretches. And obviously moms are in that category too, I'd say, new moms, of babies waking up through the night and they don't get probably a lot of quality sleep. If you were sort of talking to a new mom and trying to get her to get more quality sleep, how would you sort of advise her to kind of get more sleep? Or, does she sleep when the baby sleeps during the day? Like, what could she sort of do to maybe help herself?
Yeah, that's tough. That's a real challenge. And I don't think that kind of napping during the day really makes up for the deep restorative sleep that happens at night. Right?
What are your thoughts on, because I've heard kind of contradicting on this, but like napping throughout the day, if you're tired, is it actually a good idea to nap 20 minutes or so? Because I heard obviously going into sleep cycles, I'm not sure, I'm not a sleep expert, obviously, but I don't know sort of how long does it take to get into that cycle, or are we kind of just briefly sleeping and not really getting an adequate energy boost? Because I know for myself included, if I go to sleep, I sort of wake up even tireder, which is probably not good either, right? It's not very good quality.
Yeah, and again, I would personalize that. I think what's the most important thing is that we try to be in sync with the circadian rhythms of the earth, right? So we are meant to sleep when it's dark, and we're meant to be awake and active when it's light, right? So, when you have reversal of that, like there are some people that, back to like the sleep quality thing, it's not just about amount, because people that say that do shift work, maybe they get 8, 9, 10 hours of sleep during the daytime.
And that's tough. Okay. I've done that one too.
And then they're awake at night. Well, we know that, nurses that do shift work, there's a connection between that and cancer, breast cancer. So shift work is actually considered a carcinogen. So, so as much as possible, I would say, it takes signals from nature, it takes signals from the environment. We need that exposure to darkness, and we need that exposure to natural light. So, but yes, if one needs to nap, do take that rest. But if it is interfering with you being able to sleep at night, then maybe it's not right. It's not the best approach.
Right. I totally understand the night shifts too. When I was doing my nursing practicums, I was having to do the night shifts. I think it was like 11 p.m. to like 7 in the morning. And even though I was able to stay awake, it didn't feel normal. It didn't feel natural. Like my body was almost screaming at me, like, you need to go to sleep, and trying to sort of force my body to sleep during the day. Even with blackout curtains, it was again, that rhythm, right? It just wasn't there. And it takes a lot of recovery, I've noticed, to kind of get yourself, into that different rhythm.
Absolutely. Yeah. We weren't designed. We are diurnal creatures, meaning we're not nocturnal, right? We are, but some animals are, right? You know what I mean? So we're meant to be, doing things during the daytime, and we're meant to be sleeping and resting at night.
Definitely. Love it. So thank you. Yeah. So what's number 3 for us today for this one?
Well, other lifestyle things, movement, being connected to nature, managing our stress. We've already kind of touched on the nature piece, like being, in tune with the cycles of the earth, right? Yeah. So that is, that's how we evolved. That's how our ancestors lived, right? Definitely. So, as much as possible, it's not just about, vitamin D and being outdoors, but it's about setting our circadian rhythms. And there's just something really healing about being out in nature. Right?
I agree. I do that too. And I think that's probably why, as a family, we always like to go outside, whether we're, in the mountains, walking in nature. There's just something about the breeze, the trees, the lakes that we're walking beside. It's like it brings you back to like sort of that rhythm. And I think it is a good stress reduction, I think, for a lot of people.
Absolutely. Yeah. We can generally feel better, but there's something really physiologic going on. There is there are negative ions that, are put out by, trees and natures and even the earth. And we can absorb that and kind of help, offset that positive charge that we all tend to kind of carry.
That's right? Interesting.
So it helps neutralize the body's pH,
that's
body's energy. Yeah.
That's must be what it is, because I think when you go into nature, you don't know really why, but it I think it's the combination of the exercise of, like, even if it's just a walk, the movement, the fresh air,
for sure.
The trees are giving off oxygen, right? So it's probably, it's just something, it clicks. I don't know. And I love that. With everything going on right now, with everybody feeling so stressed and tense, that is a massive one I've noticed, and it can cause so much illness for people and lower their immune systems. Can you talk a little bit about that?
Yeah, I mean, collectively, we are experiencing just a huge amount of stress. There are, you know, and there's an epidemic of mental health, you know, problems and crisis.
Yes.
Right. You know, we've experienced, you know, isolation and stress and fear, and that's taking a toll, right? You know, in terms of, you know, what else, you know, that can predispose us to getting, you know, catching things, lowering our immunity. But, you know, immunity is not just about, oh, you don't want to catch a certain virus or an infection, but it's also about like things like cancer. That's an immune related problem.
Definitely.
Right. You know, but certainly, you know, stress is a huge risk factor, you know, for immune related stuff. And that is also about like, how does one not get, you know, something like cancer, right?
Right. I've heard, I guess the notion is that you can hold a lot of emotion in your cells, whether you're eating healthy, you're taking care of yourself, like this, that's that one side, the physical aspect of sort of nutritionally supplements, exercising, doing all the right things. But then if your stress level is like extremely high, myself included, you know, when your stress levels are peaking, it can really lower your immune system down. And is there sort of a chemical thing that's going on? Like, are we raising our white blood cell count or anything like that? Like, are we on a defense system, do you think?
Well, I mean, stress is a catabolic force on the body. It means that it breaks us down, right? You know, so yes, it can weaken immunity for sure.
Yeah, exactly. Okay, well, that was great. So we have one more to talk about, and what would that be?
Good nutrition.
Yay! Good nutrition. That's all I talk about is good food.
Yeah. So yeah, where do we start with that? Like, I would probably, you know, as a baseline, first step is, you know, avoid processed food as much as possible.
And I noticed, not just watching, but, you know, watching statistics and stuff too, is that during this whole thing that was going on, people were buying more processed food than anything, because I think the stress levels were so high, people were comfort eating. So again, on a big level, we're also lowering our immune system with the processed food because of the stress. So, you know, there's a couple of factors I've noticed personally myself, is that the food prices are going up. Unfortunately, produce is going up, and the stress levels. And I think that's why I've noticed personally people are eating less quality foods. Can we maybe sort of talk around like some foods that we could maybe increase our immune system? Like, is there specific vitamins in foods we should be looking for, or color of foods we should be looking for, or where to buy?
Color foods, color, you know, rainbow. So, and produce, right? So, lots of like real food that, if we can, that is not coming out of a box, right? You know, so that at the grocery store would mean like, you know, the perimeter generally of the grocery store. You know, not so much the boxed goods, but, you know, trying to eat as much as possible all of the colors, right? You know, the blues, purples, reds, greens. You know, even whites, that would be, you know, cauliflower and, you know, onions and garlics. But yeah, so trying to get a variety, you know, of real foods. And you know, our veggies are produce and fruits. But, you know, I think that, you know, animal products are also something that I think helps, you know, support good health.
Yeah, that's kind of probably another subject, because this goes into a little bit more, we're shifting over more to a plant-based. I think that's with the whole, you know, food guide and everything that's been come out. what's your thoughts on sort of our immunity with the meats that we're eating today? Like, do you see that there's more hormones in our meats, or should we be avoiding red meat? I know it's kind of by person basis usually, but kind of in a general way, what could you kind of tell people?
Yeah, I mean, in my experience, plant-based can be code for vegan. Okay. And I'm not, again, it's a personal thing, but that's not something that as a rule that is, I would recommend to everybody. I would like using the word or the phrase plant-rich. So lots of plants and healthy, well-sourced animal products. So that means not, factory farmed animal protein, if possible, organic, pastured meat from healthy animals, right? So if animals are raised properly, then they don't need a lot of antibiotics, right? So, of course we're getting all of those exposures from, animals that are raised in cages, right? So that's not going to be, an animal that is not healthy or healthfully raised is not going to be providing good nutrition to humans.
I've noticed that too, sort of the best places I've sort of seen, I guess, like wild caught fish, I would say, or antibiotic free pork or beef or bison, probably I would say in a farmer's market more than anything. It's a little bit more costly, but the meat, like you can tell the quality of meat is so much better. And you're not getting all the antibiotics and things and the hormones. Again, there's so many different varying topics from everything we've talked about, because that can go into, how we've grown up in different generations and what our kids are eating now versus what we ate. Like I still remember, the milkman coming by with glass bottles. Like that doesn't happen anymore.
Yeah.
And the other one I wanted to touch on was just with the food and like transportation. What's kind of your view, I guess, now on the food and how it was grown back then and the soil content versus the soil content now, and how are foods sort of being delivered to us? Like, are we getting the vitamins through our foods properly? Like, or is it kind of being ripened in transportation?
Yeah, that's a good point. In my practice, I do a lot of testing, and I do a lot of like micronutrient testing. So I actually measure nutrient levels with my patients. And, a lot of my patients are pretty aware, and some of them are already, eating very well and have, decent lifestyles. And yet, even with that, we can still be depleted in nutrients, right? So even if we are achieving that very difficult goal of eating perfectly, food is not perfect, right? It's not as nutrient rich as it once was. And that is, for some of these reasons that you mentioned, it's not, locally grown. It's coming from who knows where and across great distances. Right. And then, soils are not as nutrient rich as they once were. So that's a whole other topic then of like, okay, maybe even eating ideally is not well enough. And I think that is the case, and that we will need to kind of also supplement a good diet with some nutritional supplementation. Yeah. I
usually recommend the food first for people. And then like you said, you see people that are eating everything they're supposed to and they're still not absorbing enough from the soil and everything else that it's grown in. And that's sort of when we start to look at, okay, what can we sort of give you to supplement? But again, that's kind of a as per basis per person, obviously. So that's amazing. So thank you so much for coming on to the Nutritious and Delicious podcast here today and educating our viewers. Yes, thank you.
Thank you. It was a pleasure.
Yeah. So how can our viewers actually get more information about strengthening their immunity with you?
I have a website, and there are a couple of downloads that are on there that somebody could peruse and see if that is helpful to them.
Okay, excellent. Yeah. And I think you mentioned before that there was one about leaky gut syndrome. Is that something that people should be going on and finding that on your website?
Yeah, I think there's some really basic information on there that can be helpful to the average person.